Welcome everyone to OHMM's March webinar. We're excited about today. It's a myth-busting webinar, the incarceration of women living with HIV in Ohio and across the nation. My name is Adam Riley. I'm the prevention manager for Caracol, and I'm going to be your moderator for today, so welcome. Our speakers today, first we have Naima O'Neill, who is a licensed medical social worker at Circle Health Services, where she works with people living with HIV and the interdisciplinary medical team that provides care and support. Prior to this, she worked as an HIV test counselor. Naima has also served as a member of the Ryan White HIV Planning Council several times since 2003. She is an experienced public speaker and has focused on sexual and reproductive health, supporting mothers living with HIV, HIV disclosure, advocacy, and housing issues at events and educational forums like this one. And Naima will be joined today by Amir Sadi, National Policy and Partner Strategist. He earned his Master's of Arts in Philosophy from the New School for Social Research. While at NSSR, he focused on political theory, social upheavals, and strategies where biopower and state violence clash. He continues to teach debate and public speaking with the Rikers Debate Project at detention facilities on Rikers Island, New York. He is an advocate for people who are incarcerated and answering the severe social costs to the criminal punishment system. Before we get into our talk today, we're just going to talk a little bit about OHMM and what our mission is. So OHMM, we are a coalition of organizations and individuals dedicated to ending the criminalization of HIV in Ohio. We are mobilizing a broad coalition, including individuals and communities who are disproportionately impacted by HIV, to replace fear-based stigmatizing laws that criminalize HIV status with evidence-based, non-discriminatory laws that protect public health. Organizations that are part of OHMM include AIDS Task Force of Greater Cleveland, AHF Ohio, Canopy, Caracol, Equality Ohio, Equitas Health, and the University of Toledo College of Medicine. And what are we expecting today? So we're going to learn about Ohio's HIV modernization efforts, understand why we need to modernize now, also gain some knowledge about national trends related to women being incarcerated, especially due to their HIV status. Gain knowledge about a state, in this instance, Ohio, trends related to women being incarcerated, especially due to their HIV status. And then we're also going to learn about the unique challenges that women face when being charged with felonies, and those felonies that are related to HIV status. So we hope you engage with us today on social media. These are the hashtags that we're using. So please engage on all social media platforms. We've got hashtag HIV Law 2021, hashtag Modernize Now, hashtag HIV is not a crime, and hashtag OHMM. And you can go to the OHMM website to our ohmodernizenow.org/I'm in campaign to sign up and be part of the process and part of the movement that we're trying to put together here at OHMM. And also go to our website and sign up for the movement, and then be added to this number that we're calculating on our website of those who are in support of the movement. And with that, I'm going to go ahead and turn it over to Amir.
Thank you so much, Adam. I'm going to go ahead. Hey, everybody. It's great to see you all. I see a lot of familiar names in the participant list. As Adam said, my name is Amir. I use he, him pronouns. I'm the National Policy and Partner Strategist with the Center for HIV Law and Policy. And you should be able to see my slide deck now. At CHLP, I work both on the Positive Justice Project, which is the nation's first collaborative formed to end the criminalization of all stigmatized diseases, including HIV and viral hepatitis, and also the Sexual Health Youth Advocacy Coalition. There's my email on this slide, but I'll make sure to drop it in the chat as well if you'd like to stay in touch. I'd like to just share a little bit about CHLP. So I mentioned that the Positive Justice Project, this national movement and collaborative formed to end the criminalization of people living with HIV. There is a Positive Justice Advisory Group, which is an advisory body made up of people with lived experience, people living with HIV, people affected by other stigmatized diseases, public health experts, legal experts, basically a group of people with lived experience and experts who guide the national strategy to change HIV criminal laws in the United States. We provide legal and policy analysis for advocates across the country, helping them draft legislation, building their advocacy power to form a movement in their state and change these laws. And we've done so in 20 US states to date. We've worked with defense attorneys across the country representing people living with HIV, including some high profile cases that you may have heard about, maybe cases that actually, is what brought HIV criminalization, to you if you're not a person living with HIV who's been affected in other ways. We also coordinate the National Prosecutors Roundtable on HIV Criminal Law, which is a partnership with the Association of Prosecuting Attorneys. And that partnership has led to the reduction of charges or dismissal of charges in at least 4 jurisdictions. And we're working on some guiding principles with prosecutors to bring them up to speed about why relying on the criminal law to address a public health problem is an unjustifiable mistake. So today, I'm just going to share with you a very brief overview of HIV criminalization. My portion of this presentation today is not going to be kind of an HIV criminalization 101. We're going to be digging a little bit deeper on the national perspective of criminalizing disease exposure and the national perspective on patterns in enforcement data that show that it's women, and especially Black women, who in many states are overrepresented and deeply affected by these laws. And, I don't want it to go without mentioning that today is International Women's Day, and we're, looking forward to the approach of National Women and Girls HIV/AIDS Awareness Day. So this is, I think, a really important opportunity in this event today with you all to kind of unsettle some myths that we might tell in this movement about criminalizing people living with HIV, about how these laws are used, about who's affected, and also look at the bigger picture of HIV criminalization in the context of mass incarceration in the United States. Okay, so what is HIV criminalization? For folks who might not know, HIV criminalization is basically using any criminal law in a way where someone's HIV status is the necessary component of the offense. So in some cases, that'll be an HIV specific crime where a person can be criminalized for engaging in consensual sex. And what triggers that prosecution is simply their health status as a person living with HIV. Consensual sex is legal for people not living with HIV. And in many states, if you're a person living with HIV and you do not disclose your status prior to, it is in often cases a very serious felony crime. Or HIV criminalization can take the form of increased penalties or enhanced penalties for people living with HIV engaging in types of conduct that might be a less severe offense if you're not a person living with HIV. So one example of that might be solicitation or engaging in sex work. Traditionally, those offenses are misdemeanors in most states, but if you're a person living with HIV and you're targeted by law enforcement, your penalty is automatically bumped up to a felony simply because of your health status as a person living with HIV. These laws are typically, written with an understanding that that HIV is a highly infectious or highly transmissible disease, and that an HIV diagnosis is comparable to a death sentence. Right? These are really stigmatizing laws. 30 US states currently either have an HIV specific law or a sentence enhancement targeting people living with HIV. And in 6 states, including Ohio, and I know we have a lot of folks from Ohio joining us today. In 6 states, including Ohio, these HIV-specific offenses might trigger sex offender registration after a conviction. So people living with HIV who might be engaging in consensual sex or might be criminalized for things that cannot even scientifically transmit HIV would then be forced onto, public and stigmatizing sex offender registries, further affecting them even after their conviction, further affecting their access to housing, further affecting their access to education, social services, how they might interact with their own families if they can't, visit a school or a playground where their children might be. In 25 states, people living with HIV have been prosecuted with the general criminal law. So that means things like reckless endangerment, aggravated assault, even all the way up to assault with a deadly weapon and attempted murder. We have seen prosecutions, really serious prosecutions with general criminal laws targeting people living with HIV across the country in those 25 states. Actually, even in one state we're aware of, Michigan, there has been a prosecution with the state's bioterrorism law against a person living with HIV. So this is a map to just help you visualize the national scope of where people living with HIV might be criminalized. In the kind of darker maroon color, you can see the states that have an HIV-specific criminal law. In the lighter kind of yellow-orange color, you can see states with those sentence enhancement, and it's kind of represented by diagonal lines on this map. And with the darker orange color, you can see states that have used general crimes to prosecute people living with HIV. The yellow balloons on this map, it might be kind of hard to see depending if your screen's not full screen right now, but this map is easily accessible on our website, and I'll make sure to share a link to it in the chat once I've gone through this presentation. But those yellow balloons show the states that have sex offender registration for people living with HIV as part of the punishment. It's important, I think, to think of HIV criminalization as not just the offenses, but also the post-conviction issues like sex offender registration that disrupt people's lives. And the states with the green balloons on this map show the states that have either really substantively changed their laws by either repealing them, as New Jersey most recently did this year, or by significantly reforming the law to require that prosecutors have to prove someone intended to transmit it, by requiring that prosecutors have to prove that the conduct that's criminalized, the things that people living with HIV might do, had to have actually posed a scientifically verifiable risk of HIV transmission. This is, I think, a really interesting representation of when HIV criminal statutes have been enacted and when they've been changed. And you can see on the left side of your screen, this information is kind of organized by year, with the states represented at the top of the chart being in an earlier time frame, and as we go, proceed down the chart, we proceed forward in time. And I'm going to return to this information a little bit later when we're doing our myth busting. But I did just want to point out for folks who might be engaged in HIV criminal legal reform advocacy, you might think that HIV criminal laws were written a long time ago when we didn't know anything about HIV. When HIV stigma was incredibly potent, and newspapers were calling people like Nishan Williams a monster. But if you look at this information on this chart, I think it's eye-opening, because it shows that states have continued to enact HIV criminal statutes well into the present and have changed their laws well into the present. And many of these changes have actually expanded the scope of prosecution or made the laws more severe, not less severe. So that's one of the myths that we're going to talk about a little bit later. And this is a timeline on this slide where you can kind of see how states have worked to change those laws, have either kind of expanded that scope of prosecution or restricted it, and made a meaningful change in the lives of people living with HIV. And I don't have that much time to dig too deeply into this timeline, but it is another resource on HIVlawandpolicy.org, and I'll make sure to drop some links for you if you're paying attention and listening along. One of the major problems, I think, with HIV criminalization is that there's no evidence or data to show that these laws or prosecutions deter risky behavior, or that they reduce HIV diagnoses in a state. There's no evidence or data that shows that these laws reduce new HIV diagnoses. And actually, something that we hear from advocates on the ground is that these laws discourage connecting into care, connecting to HIV testing, because you can only be criminalized if you're aware of your HIV status, if you've been tested. And one of the reframes we hear from advocates on the ground is take the test and risk arrest. So we're talking about a system of criminal legal punishment that really actually alienates people from care and makes the work of ending the HIV epidemic even more difficult. And there's a lot of strong data out there that some of which I'm going to dig into in a moment, that shows that these laws disproportionately affect already marginalized communities, people who are already targeted by the criminal legal system, including sex workers, LGBTQ communities, people of color, especially Black women and men. And lastly, these laws really promote a lot of stigma, pushing people even further into the margins. I do think it's important, since we're going to be talking about the impact of HIV criminalization on women and on Black women, to show that barriers to care in this country affect Black people, including women. And we can see that Black people are overrepresented in HIV diagnoses in this chart. But this chart, I think, is even more striking. And this is all information from the CDC, and I can share these slides with you after this presentation if you think they'd be helpful to you. But Black women account for 60% of all new HIV diagnoses nationally among women. So 60% of new HIV diagnoses amongst women are applied to Black women specifically. And in Ohio, Black people make up 52% of all new HIV diagnoses as recently as 2020. So in the year 2020, according to the Ohio Department of Health HIV surveillance program, 52%, half of all new HIV diagnoses accounted for in Black people, but Black people account for 13% of the state population in Ohio. And the rate of new HIV diagnoses is 10 times higher among Black women than among white women, in Ohio. Now, I think that context about HIV prevalence and how racist barriers to care affect the work to end the HIV epidemic in Ohio and really across the country is important to frame into the context of patterns of how HIV criminal laws have been used against Black people, against Black women, and against women. So all this information that I'm going to present right now comes from the UCLA School of Law Williams Institute. I saw that we had some friends from the Williams Institute listening along. It's great to have you here. This strong overrepresentation of Black people in convictions for HIV-related crimes in these states represented in this slide, which is from an infographic on HIV criminalization and race, which can be found on the Williams Institute's website. But you can see, the blue bar on these graphs is the state population. Then in yellow, of people living with HIV, and then in orange, HIV-related convictions. So, For example, if we just look at Florida, 16% of the state population living with HIV is Black. Of the state's population is Black, but 45% are people living with HIV, and 56% are implicated by HIV-related convictions. So you can just see a pretty significant overrepresentation of Black people in convictions across the board. And that when we're looking at the impact against Black women because of the sentence enhancements and the disproportionate level of enforcement against Black women, we can see also a really significant overrepresentation on these slides. And there's even some information about Ohio on this slide here. And again, this is all from an infographic, a really great one-pager on the Williams Institute's website, where you can see these how the state population stacks up against the people living with HIV, and then how that stacks up against people affected by HIV criminal arrests. And some states, the overrepresentation is less slight, and in other states, there's a much more significant impact on Black women for HIV criminal arrests that target sex workers. And that intersectional frame of the relationship between HIV criminalization and criminalizing sex work is, I think, a really important one for us to unpack today, because we know that sex workers are overrepresented in HIV criminal arrests and prosecutions, and that according to the Williams Institute's data from some states like Florida, for example, Black women are overwhelmingly the most likely group to be convicted for an offense in sex work while living with HIV, or sex work while affected by an STI related offense in states like Florida and in other states too. And that, I think it's important to also remember, since a lot of us are in Ohio today, that Ohio is one of those states with sentence enhancement or a higher level penalty for sex workers while living with HIV. And we're talking about activities that pose little to no risk of HIV transmission being criminalized, such as even like erogenous touching or merely offering to engage in sex work. Those are punishable as felonies in Ohio and in other states too. These laws, HIV criminal laws affecting sex work, typically do not protect people who take means to prevent an HIV transmission. So if you're a person living with HIV and you're virally suppressed, or you were, engaging in types of conduct that cannot transmit HIV, or you're using another kind of prophylactic device or another way to prevent HIV transmission, these sentence enhancements, it doesn't really matter, right? You could still face really severe, significant, and harsh felony convictions for simply because of your health status as a person living with HIV. And actually, it gets even worse than that, because in some places, including historically where the Center for HIV Law and Policy is based in New York, the mere possession of condoms or other things to prevent HIV transmission have been used as evidence in prosecutions as proof of an intent for someone to solicit for prostitution, to engage in sex work. So we're talking about a patchwork of laws and policies that makes sex work even more violent and more dangerous for sex workers, including people who are living with HIV, rather than protecting and making those practices safer, right? Because if sex workers might be criminalized and punished simply for carrying condoms, there's a direct contradiction there with the work that states like Ohio and other states are doing to end the HIV epidemic. And I think, it's important to remember that HIV criminal laws aren't really here about consent or protecting people from harm, because applying HIV criminal laws against people and against women don't do anything to end the social inequities that make women and girls more vulnerable to HIV, sexual violence, or intimate partner violence. Actually, according to some resources on our website, these laws actually increase the risk that women might be prosecuted for HIV-related crimes, because women typically are the first to become aware of their status, thereby increasing their risk of really serious, harsh felony prosecution. Now, women account for the fastest growing segment of the US incarcerated population, which I think is a really important information to ground this discussion that we're going to have today about the impact of HIV criminalization on women and Black women. And I have some, I think, really surprising data for you here. In 1970, 3/4 of US counties didn't house a single woman in their jails. And as recently as 2019, there were over 230,000 women and girls incarcerated in prisons and jails across the country. So the rate of women incarcerated has increased at twice the rate as the incarceration of men in states' prisons. And this is all according to information from the Prison Policy Initiative and the Vera Institute for Justice. So I think just, simply to reflect on that, as in 1970, 75% of US counties didn't house a woman in their jails. Today, they account for the fastest growing incarcerated population in this country, which you can see actually reflected on this graph from the Prison Policy Initiative. We can see the rate of growth of incarceration for men's states prisons and the rate of growth for the incarceration of women in states prisons, women being the orange color line on this graph. So you can see just how quickly and rapidly the incarceration of women has grown in this country. And I think that, with that context, what do we know? We know that Black women are disproportionately affected by HIV today because of racist barriers to care, because of racist housing policies. We know that Black women and women in general are the most likely targets of having their health status weaponized against them in many states. And we know that women are the fastest growing segment of the incarcerated population. But we're not really solving those underlying systemic conditions and barriers that are affecting those vulnerable communities. So, and we also know that Ohio's really harsh and stigmatizing laws are destroying people's lives and putting women on sex offender registries, which is, further unleashing harm on them and their families. We also know that, as I mentioned before, and you can see on that data that I presented a little bit earlier, that we also know that it's not true that most HIV criminal laws were adopted back when we knew little about HIV, right? I think it's important to remember that the Surgeon General in 1987 addressed the American public about the roots and risks of HIV transmission, about how certain kinds of exposure or conduct could not transmit HIV. That was a public letter sent to every American in the late 80s. And you still have states enacting really severe, harsh felony HIV criminal laws across this country long after the Surgeon General Everett Koop addressed the American public. We also, I think, should remember in this discussion that HIV is not the only disease that's criminalized. Most STIs and communicable diseases are, there's usually in the public health code some kind of misdemeanor offense, that those laws are not traditionally enforced the way that HIV criminal laws are enforced. But Ohio, like several other states, does criminalize viral hepatitis, which is a third-degree felony in Ohio for a person living with viral hepatitis to expose another person to certain bodily fluids. And this also deeply relates to the problem of mass incarceration in the United States, right? The United States incarcerates more human beings than any other nation in the world. And 1 in 3 people incarcerated in US prisons and jails is affected by hepatitis C. But less than 1% of those people in detention affected by hepatitis C are receiving treatment. So the carceral system and the criminal legal system really we know it reflects existing biases in our criminal legal system. HIV criminal laws do, and are used to punish already deeply marginalized communities. And we're making the work to end, public health issues even more difficult by fueling poor Black and brown people and sex workers into, carceral settings. And, something that I think Ohio Coalition member often says that I really, something that really resonates with me is that, which I think is an Audre Lorde quote, that we don't, lead one issue lives, so we can't lead one issue fights. And we have to act with a view on those intersections. I think if we really want to be serious about the work to end the criminalization of people living with HIV, we can't end the criminalization of people living with HIV by not including sex workers, by leaving them behind. And any kind of reform strategy that leaves sex workers behind, that leaves women behind, is doomed to fail. It's unethical and it's unjustifiable to do that. So I think, one of the lessons that I've learned from the national perspective is that movements and states that engage in cross-movement organizing, building relationships with sister movements, with racial justice movements, harm reduction organizers, sex work decrim, those movements are going to be much, much stronger and will be able to see those intersections and protect all marginalized people affected by these stigmatizing laws. So a lot of this information is available on our website. We have an HIV policy resource bank with thousands of resources available for free. So please visit hivlawandpolicy.org and you can reach out to me. I'm going to share my email address in the chat, and I will stick around for Q&A as well. But thank you all for having me. And then with that, I'm going to pass it.
As the facilitator of the Ohio Health Modernization Movement, one of the things that I've been fascinated watching happen is a research project we're doing here in Ohio. And we're doing it in collaboration with the Williams Institute. And Nathan, I saw you out there. And so Williams Institute has looked at arrest records, and in Ohio we've had a series of legal fellows, legal interns, lawyers who have made a 2-year project out of trying to look at Ohio's actual charge and conviction records around the 6 HIV statutes in Ohio. As I mentioned, that's taken 2 years. They've had to make requests of each of the 88 counties separately and then collect data from those counties. We are towards the tail end of this, and I'm going to give you a sneak peek at some of what we know at this point. But these numbers may yet change, as Cuyahoga County and Franklin County still could affect these numbers. And for those of you who are from Ohio, Cuyahoga and Franklin are 2 of the 3 largest population counties in Ohio, so they could have a marked effect. But little sneak peek at what we're doing. And what I'm going to put the sources for this, not our data yet because it's not published, but I'll put the sources for what I do have up here that does have sources after I'm done. But if you look at the left-hand side of this slide, Ohio general population compared with the population of people living with HIV, and some of this Amir has alluded to in his presentation as well, but you can see the blue bars are the general population numbers. So for example, Black women make up 6.6% of the population in Ohio. And then the black bars that you see are the percentage of Black women, for example, here who are living with HIV is 11.69. So when we say that they are overrepresented, it's because they far exceed that 6.6% that they are of the general population. So you can kind of see some of those numbers here. You can see that Black people in general are definitely overrepresented as people living with compared to white folks in Ohio. So what we have done, by the way, I want to do a shout out to Case Western Reserve University's legal fellows who have done a lot of this work for us. is some of our preliminary, I want to repeat that again, preliminary results from that work. We have, at the moment, 130 cases that we looked at, and we're only looking at 2014 through 2020 for all 6 of the criminal statutes that exist in Ohio. And by the way, one of them we cannot find any evidence that it's ever been used, which is the felony enhancement if you were to try to donate or sell a blood or organ. What we see then is that of those 130 cases, 57 of them involved Black men. White men. 57 involved white men, 36 involved Black men, 7 were Black women. I will note that of those 7 cases that involved Black women, that 60% of those resulted in conviction. And then 8, there is men who weren't identified as white or Black, which means they either didn't enter the race or they identified in a different way. But there's only the little one up there is white women. This, if you do the math on this, Black folks clearly are overrepresented based on their 6.07% of the general population or 6.6% of the general population, depending on whether we're talking men or women, are clearly overrepresented in these criminalization usage here in Ohio. I also want to point out that the way Ohio keeps these statistics, we really cannot tell whether, who amongst these folks are actually trans men or trans women. The state does not keep demographics that would give us that information. So in some of these cases, men, people labeled as men may actually be trans women, and people that are labeled as women may actually be trans men, but we cannot get that information for you. Anyway, I just wanted to give you a little bit of a sneak peek. We do hope to be done this month, and with the help of the Williams Institute, be able to give you some really good picture of how these laws are being used in Ohio. I am at this point going to turn it back over to Naima, your regularly scheduled speaker at this point, to talk more about the impact, less from a numbers and statistics viewpoint and more from a real life perspective. Naima, back to you.
So, hi everyone. My name is Naima O'Neill. I am a medical social worker. I'm also a woman living with HIV. And so I would first like to acknowledge too that this is National Women's History Month. And so it's fitting that we are having this conversation about women living with HIV and the stress that it may cause women, and talk about myths, because myths are important. And so the huge elephant in the room is HIV criminalization. We don't want to talk about it. We don't want to talk about how it impacts people in general living with HIV, but it also impacts our community. So one myth buster is that women were never involved at the beginning of when HIV got started or when it first came on the scene, and that's a myth. Women have always been a part of this epidemic. They just never were talked about. And so they were kind of the invisible piece that was in the conversation. No one ever talked about it, but women were acquiring the virus. They were living with the virus. Another myth is that women weren't at risk. So a lot of women felt that because gay men were what was talked about in the news and society, that they were not at risk for acquiring a virus, which is definitely not true. And so we have some unique situations, because if we are convicted of a felony, we can be labeled as a sex offender. And we know that women take care of their families. We know that women are the ones that are the nurturers. They have children. And even if they don't have children, they still are part of someone's community and helping as an auntie, as a niece. And so if you are a woman that's living with HIV and you're convicted, then you have to step out of that part of the life. First of all, they don't want you to have children, which is a myth, because women living with HIV can conceive, can have negative children, can breastfeed. But in some states, you could be arrested. Your doctor can arrest or call the police if you say that you want to breastfeed your child. And that's a big myth. Because of U equals U, women are able to have kids again. And so we need to bring the criminalization conversation and bust these myths so that people can be normal. And if you, that part about what Amir said about take the test and risk arrest, that's real. And the people who are actually sharing their virus are ones that don't want to get tested. They're very at risk. They don't want to get tested, and they know this. And so we need to bust these myths. We need to take away stigma, because sometimes people living with HIV have their own self-stigma. And so they have it before society lays their stigma on. So even when we are talking about women, we're talking about families, we're talking about housing, we're talking about sometimes women have to do things to take care of their families, and that may be having consensual sex and getting paid to do it. So sex work gets real. If we're not offering women an alternative, if we're not offering them wageable money so that they can earn a living that will take them past getting a voucher or take them past living one paycheck to the next. So we are actually not working on trying to get rid of some of these things, because ending HIV is in our control. And that's another myth that women and people living with feel, that we don't have a control over ending this epidemic. And in my lifetime, I feel that we do. I feel that we're able to get rid of HIV, but it takes the whole community. It takes us getting a handle on these laws so that people are not afraid to get tested, and then finding out everyone that's tested. So you're either HIV positive and you're being treated, and you're HIV negative and you're making sure that you stay HIV negative. So the whole community needs to do this. And it's not, right now the burden is placed on people living with, people that know their status. And I think that that's the reason that this virus is allowed to grow. Because for women, if you are in a relationship and that person knows that you're positive, they could hold you in a relationship that's not healthy. And a myth is that people think that they can't get arrested. So I live with HIV, and my fear is that someone could decide that they want to accuse me of sharing my virus with them or not saying that I'm positive, which I never do, but it could happen. If the police get involved, I could be arrested, and before the dust settles and before everything is discussed, I can lose my job, which I love. I can not have access to my beautiful grandchildren. I have 3 now. So there's a lot of anxiety and stress. And so even if I've ever arrested, I live in fear sometimes of that happening to me. And so I am going to end there. This is a topic that could go on forever. Amir and Kim talked a lot about statistics, but this is a real life issue that we need to really get a handle on, because women can have babies now. I have people in my clinic that have had children. And so we need to be able to nurture women. And we also need to bring heterosexual men into this conversation. And they need to partner with us because women, unless they have another mode of transmission, are acquiring the virus from their partners. And so we need to have them as a part of a conversation. And I'm going to end there so that if people have questions, they can ask those questions because we're getting close to the end of our hour. So I will end there. Thank you so much for listening.
Thank you, Naima. I actually have a question that I'm wondering if you or maybe Amir would be able to answer. So we're talking about modernizing the laws, and that hasn't happened yet. That's our goal, and we're working towards that. So since we're living in a world right now when they haven't been modernized, can you talk about some strategies that you might suggest people use to protect themselves in some way to not get charged?
Well, as a social worker, I don't know if I can prevent you from being charged, but I do know that when you have a partner, it's important that they know your HIV status and not just from you, because then it becomes a he said, she said thing. But if you bring them to your provider or bring them to your social worker and then disclose your status, all of that information can be used if you are charged. But I would defer to Amir, because I don't think that it would stop you from getting charged. It may stop you from being convicted, but I don't think it'll stop you from being charged.
Yeah, thanks. I think it's a great question, Adam. And, it's one of the things that the Positive Justice Project has focused on in the past by working with state level advocates to create palm cards with information about the state's law and important steps that people can take to protect themselves against a prosecution, against information about like the importance of documenting the disclosure of one's status. Because as Naima said, what ends up happening is, even if you do the thing that the law tells you to do and disclose your status to your partner, there's always the risk that someone that you might have been sexually active with will tell law enforcement that you didn't disclose, even if you did. So I think, a couple things that might help are just educating yourself and your community and your friends and your family about the law in your state. And there are resources on like the HIV criminal law source book on our website that has every state's criminal law kind of digested in a easy to read, non-legal way, easy to read for people like me, who I'm not a lawyer, I'm not an attorney. So I think resources like the source book are pretty great. But educating oneself about the law and doing things like documenting disclosure of your status can help. But I think on the other level, some helpful, some helpful tips might be for your, if you're an advocate, just, a member of a group like OHMM, and you're working to change your state's irrational and stigmatizing laws that punish people living with HIV, educating law enforcement, meeting with prosecutors, sharing resources with them about HIV, basic HIV literacy, I think is so important. Because, a running thread, I think, through this conversation about, protecting yourself from prosecution, and also just the bigger picture of HIV criminalization at large, is that I think we're at like a sexual health literacy crisis in this country. We're at like an HIV literacy crisis, which is surprising given some of the information I shared earlier about how, you know, Surgeon General C. Everett Koop addressed the American public in the 80s about how HIV is and is not transmitted. And still today, in 2022, you have lawmakers, not all of them from one party, right? This is HIV criminalization, sadly, isn't a one party supports this, one party opposes this kind of thing. I can tell you, I've seen lawmakers try to pass laws, liberal lawmakers try to pass laws to make these laws even more severe and more harsh in today, right? So I think we need more HIV literacy out there. And if you're listening to this and you work at a state health department, or you work for a public health agency, or you're some other kind of stakeholder, there's a lot more you could be doing, I think, to educate law enforcement, educate prosecutors and judges about basic HIV literacy, basic sexual health literacy. You know, and that's, I think, an important piece of this too, is that you have states just like Florida. I just read a moment ago that the Florida Senate passed that Don't Say Gay bill that prohibits discussions of sexual orientation and gender identity in schools. This is a problem of sex ed in schools, but it's also just a problem of sexual health literacy broadly. We have medical professionals who aren't really literate and educated about how to identify and counsel their patients about syphilis, for example, which is correlated to this really striking increase in syphilis diagnoses. So I think the bigger picture is we need more sexual health literacy. We need more HIV literacy for everyone involved, for lawmakers, for law enforcement, and that I think can go a long way into you know, taking this movement to the next step.
Thank you for that, Amir. There was a question about text messaging in there as a way to share your status and have proof of that. I wonder if either one of you have anything that you'd like to add about that. And I also have kind of a follow-up, like when I think about how at least Ohio's law is written, it seems like it's very much that people are presumed guilty from the beginning. And I was, you know, kind of always told that it's the other way around. So are there other laws out there that are structured? And I know neither one of you are lawyers, but are you aware of any that are structured in this similar way where it's kind of the burden is on the person being charged to, you know, provide that?
I know for me, I think that I'm not a lawyer, but I've never heard of any other law that marginalizes people because of living with HIV. No other law have I seen. Even when you talk about hepatitis, I don't think that this is as strict because I agree, you are proven guilty and you must prove yourself innocent. That prosecutor is trying to get you to go to jail with a felony. And something that could be a misdemeanor is enhanced when they learn that you're positive. So I have never in my lifetime seen anything like this before. And I know that you can do text messages, but you need to be able, and I'm not sure if that's necessarily a way to that you can use that because it might be admissible in court, but I'm not a lawyer, so that's my own personal when you talk about that.
Yeah, and I think, you know, the only thing I'd add to, I think, Naima's great points is that the tendency that you've identified, Adam, I think really shows us what the criminal legal system is here to do. It's not really here to protect public safety. It's certainly not here to protect public health. It's making public health work much, much more difficult. The criminal legal system is really here to manage inequality, and HIV criminalization is an example of that. And I think think the sooner that advocates and organizers and people doing this work kind of realize that, to see this historic legacy of managing inequality and replacing one form of racial subjugation for another, you know, that is the history and the legacy of criminalization in the American criminal legal system. And that's, I think, you know, coming to grips with that helps illustrate the answer to your question, Adam, about, you know, hey, shouldn't the burden of proof be the other way around? Well, it's really because criminalization and the criminal legal system are here to manage inequality and not really here to keep communities safe.
I also like to add too that it was based on the fear and maybe not the knowledge of how the virus is spread. So, and even I saw on one of the slides that Ohio didn't really start their laws until the 1992 or 93 or 94, I think I saw, and then they added some other laws later on. But it really takes personal responsibility out of the equation and puts the weight solely on people who know their status. I mean, because I could be talking to someone who could be positive, but because they've never been tested, the burden is on me. So if we were in a relationship and it was sexual and that person becomes positive, who's to say that they weren't already positive and were never tested? So we don't want to talk about past relationships. We don't want to talk about how many partners we've had. And that's a conversation that we should be having when it's two consensual people wanting to to share themselves with each other. Because sex is natural. That's how we have children. That's how we enjoy each other's company. And so HIV has changed it so where people are afraid to share. People are afraid and don't want to say that they're positive because they're afraid of not being loved. And I think that is also the root of our conversation. And we just really, really need to work on modernizing this law so that people understand that you can use a condom, but you shouldn't have to be required to share. And even if you do share, you shouldn't be prosecuted and made to stay in a relationship that's bad. So it's so many layers to this whole conversation that I think that we've only peeled back maybe a couple of layers, but it goes very deep. And until we get to the root cause, this is always going to be a problem that we're dealing with, and we're never going to end HIV in my lifetime.
With these laws. Thank you for everybody who attended today, and thanks to our speakers.